Part A. Extract 1. Questions 1 to 12. You hear a dentist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. What brings you in today?
Oh, Dr. Marley, it's been quite the ordeal, honestly. It started subtly, almost imperceptibly, about 6-7 weeks ago I'd say. Just a fleeting sensitivity, you know. Like a tiny, sharp prick when I'd sip my morning iced latte, which, by the way, is usually my absolute sanctuary. I chalked it up to just, well, one of those things, maybe too much caffeine, or perhaps I'd bitten my tongue without realizing. But then, it escalated.
Escalated? How, Mihiraa?
Well, then it just morphed into this constant throbbing ache. It's mostly in my lower jaw, in the back, you know. And it kinda shoots up towards my jaw joint, right here. Sometimes, it even feels like it's affecting the ear on that same side. It's not constant, though, thankfully. It just comes and goes, almost like it's playing hide and seek. But when it shows up, oh, it's really debilitating. Chewing has become super hard, especially anything tough, like a crisp apple or a steak. I find myself automatically trying to use the other side, which I'm sure isn't good for my bite in the long run.
And what about swelling or any visible changes?
Yes. Initially no. Nothing overt. But in the last week or so, I've noticed a distinct puffiness, really along my gum line, specifically around the lower left molars. It's accompanied by this rather unpleasant halitosis, despite my meticulous oral hygiene. I brush twice daily with a fluoride toothpaste, floss religiously, and even use an antimicrobial mouthwash. I've even switched to a softer bristle toothbrush, thinking perhaps I was being too aggressive. I also tried applying a topical analgesic gel, which offered transient relief, but it's akin to putting a band-aid on a gaping wound, wouldn't you agree? I mean, my diet is relatively balanced, mostly plant-based. I avoid excessive sugary drinks, and I've even cut down on my usual evening glass of red wine, thinking it might be contributing to some sort of enamel erosion.
So you've been quite proactive with your self-care. Let's take a look. From your description, Mihiraa, I suspect a periodontal issue. The radiating pain often indicates some inflammatory process affecting the surrounding structures.
Oh dear. What does that entail? Is it reversible? I'm quite fastidious about my health, you see, so this is quite distressing.
It's certainly treatable, Mihiraa. The immediate plan will involve a thorough scaling and root planing, which is a deep cleaning procedure to remove plaque and calculus buildup below the gum line. Following that, we'll likely need to irrigate the periodontal pockets with an antiseptic solution, possibly a chlorhexidine rinse. We might also consider a course of systemic antibiotics if the infection is widespread, but let's assess after the initial cleaning.
A deep cleaning, right? So, essentially, you'll be scraping away all the unwelcome guests from my gums. Will it be painful? And how many sessions will this take? I have a rather packed schedule next month with an important conference.
We'll use a local anesthetic to ensure your comfort during the procedure, so you shouldn't feel any significant pain. It typically requires 1 to 2 sessions, depending on the extent of the calculus. Mihiraa, we can certainly work around your conference schedule. The key will be meticulous follow-up and maintaining excellent oral hygiene afterwards. We might also discuss some interdental cleaning aids suitable for your specific needs.
Extract 2. Questions 13 to 24. You hear a cardiologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please have a seat.
Good morning, doctor. Oh, where do I even begin? It's been a whirlwind, honestly. For months now, I've just not been myself. It started subtly, you know? Just a faint, persistent ache in my left arm, radiating down to my fingers. I dismissed it at first, thought I'd just slept funny or overdone it at the gym. But then, it escalated.
Can you describe the escalation, Mihiraa?
Well, then came this tightness. A really oppressive sensation right in the center of my chest. Not a sharp pain, mind you, more like someone's sitting on me. It's not constant, which is confusing. It comes and goes, often after I've exerted myself. And the palpitations. My heart feels like it's doing a frantic little jig in my ribcage, especially at night. I wake up, breathless, gasping for air, and drenched in a cold sweat. It's terrifying. I've also been experiencing this overwhelming fatigue, like I'm dragging myself through treacle all day, even after a full night's sleep, or what little sleep I get with all this going on.
I see. And what about your general lifestyle, Mihiraa? Any significant changes there?
Not really. I work in accounting, so it's quite sedentary, unfortunately. I try to walk during my lunch break, but it's often more of a brisk stroll than anything strenuous. My diet, well, I try to eat healthily, but I'm prone to the occasional indulgence, especially with stress. I used to be quite active in my 20s, but life got in the way. I've gained a bit of weight too, probably about 7 kilograms over the last year.
Have you tried any remedies for these symptoms yourself?
Oh, absolutely. I've been down the whole natural remedy rabbit hole, you could say. I tried magnesium supplements for the muscle aches, thinking it was just a deficiency. I also tried ginger tea for the nausea that sometimes accompanies the chest tightness. Nothing has provided any sustained relief, doctor. It's all just temporary masking, if anything.
Thank you for that detailed account, Mihiraa. Based on what you've described, my clinical suspicion is leaning towards a significant coronary artery occlusion. We'll need to confirm this with some investigations. I'm going to order an electrocardiogram, ECG, a cardiac enzyme panel, and an echocardiogram. We'll also likely need a coronary angiogram to precisely locate the stenosis.
A block? Oh, my goodness. Is that serious? What does that mean for treatment?
Yes, it indicates a narrowing or blockage in one of your coronary arteries, which supply blood to your heart. If confirmed, the primary treatment will likely be a percutaneous coronary intervention, PCI, also known as an angioplasty with stent placement. This should alleviate your symptoms and improve blood flow.
How long does that take? What's the recovery like?
Mihiraa, the procedure itself usually takes about an hour or two. You'll typically stay in the hospital for a day or two post-procedure for observation. Following that, you'll be prescribed antiplatelet medications. We'll monitor your progress closely. I'll explain all the steps in detail once we have the diagnostic results. Also, you will be advised on significant lifestyle modifications, including a cardiac rehabilitation program.